Thank you very much indeed. Jamie is an inspirational guy and has really had an enormous influence on my thinking recently. And so I'm really proud to be here and to be given this space. You heard that I'm working on the new coronavirus, the one that causes the disease COVID-19. And I'm doing this together with the World Health Organization. So you won't be surprised if I'm going to be focusing on that for the next few minutes. I'm going to talk about the relationship between humanity and the new virus, talking about it in quite an intimate way. I'm going to address the virus and help you to understand how I see this virus. And then I'm going to look ahead to how humans can get ahead of the pandemic by organizing themselves to be able to defend against the virus. And so the second part will be on how we humans can get ahead. And then I'm going to say how well I think we are doing. I'm going to give us a report card, and they're both on how we're doing now, how we're going to be doing perhaps in 6 months' time. And I'm going to look ahead to the prospect that we'll be having more of these kinds of viruses and ask how well are we going to be able to do. I'm going to try to do all that in 6 minutes. Of course, there's a chance that I will leave you scratching your heads saying, hey, he has not answered all my questions. Well, there will be space because there's going to be a panel and question and answer, but also do stay in touch with me. I'm accessible on LinkedIn. You can find my email on the internet. Because I really want to continue the conversation and I look forward to being able to do that. I think what we're talking about here is so important for our collective future. So what is the relationship between humanity and the new coronavirus? Well, viruses appear. Don't let anybody tell you that this is an unexpected or weird thing. We've been saying for a long time that there's going to be pandemics coming that cause problems. We, in fact, don't even call them pandemics. We say they're going to be outbreaks caused by emerging pathogens. 75% of them will come from the animal kingdom. Most of them will come and appear in a small part of the world and will fizzle out. We may not even notice them. Very occasionally they come and they stick and they cause problems. And we do have influenza pandemics from time to time. Very, very occasionally they come along and cause a major problem. And we have one of those now. Tedros, the Director General of the World Health Organization, says this is a once in a century event. And don't let anybody tell you it's a trivial event. Please don't. If they do, say to them, sorry, this is really deadly serious. Of course, the virus does not kill everybody it infects. And in fact, the number of people who are killed when they get infected is quite small. It's about 1%, possibly less. But the point is that 1%, if we've got a virus that's very easily transmitted amongst lots of people, is an awful lot of people. We're well up to 900,000 people dead as a result of this pandemic. Probably the number is much, much greater because we don't go around and count everybody. So we've already got more than 1 million people, I believe, dead, and the number will go on increasing. Because the other feature about this virus is it's sticking around. It's not going to disappear. I know lots of people would love it to disappear, and they keep saying it's going to disappear. But you can't wish viruses away. They're very, very single-minded. They just exist to multiply. This virus, I believe, is going to stick around. Coronaviruses are pretty stable. Humanity is actually coming to terms with it and is working out how to live with this virus, but it's tough because poorer people everywhere get it the worst. Whether they're people living in very densely crowded living conditions, people working in factories or other locations where they're very packed together. Perhaps they're in a crew on a ship. Perhaps they're in the detention center or in a prison. Or perhaps they're in a residential center for older people. Perhaps they're in a hospital where there's a lot of cases. You know, these are places where people are really likely to get infected. And if they're poor, it's tough. So humanity and this new coronavirus, I'd say at the moment, the coronavirus has got the upper hand. Humanity learned that it could stop the spread of this coronavirus by suddenly reducing movement so that people couldn't transmit it to each other. And all over Europe, we had a lot of countries going into lockdown. In fact, there was one point in about 2.5 months ago when half the world was living in lockdown. But you can't go on with that situation. Lockdown is terrible for poor people. And so what we've got to do is to learn as humanity to live with this virus as a constant threat without it making life, particularly for poor people, really untenable, without it increasing poverty, increasing malnutrition, increasing suffering. And that's the tough job. So the relationship between humanity and the new coronavirus, I would say we're working out how to be COVID ready in all sorts of different settings. Next point is, can we humans get ahead of it? Yes, we can. We know how to interrupt transmission, deal with outbreaks, suppress them quickly, but we got to get organized. People everywhere have to know what they've got to do. Local communities have to be integrated and respond, and governments have to create public health services that work. It can be done. Just look at what's happening in parts of Africa. Look at South Africa. It's not a totally difficult situation. There have been some real progress. Parts of India, there's been extraordinary progress, including in some of the slums. Ditto in Latin America. There's been amazing progress throughout many parts of the world. In fact, looking right across Europe, some countries have done really, really well. Humans can get ahead. We've just got to make sure they do. And that means consistent leadership. It means people having the right narrative. It means governments cooperating. It means particularly ensuring that there's not politicization. So we humans can get ahead. We must get ahead. We will get ahead. But last point, how well are we going to do in the coming weeks and months? Well, right now the situation is bad. There is a disease that's advancing, that's killing 1% of the people infected. It's killing lots of health workers. And actually the people who survive, about 1 in 20 of them have got a nasty illness called long COVID. So we must get better organized. Otherwise, in the next 6 to 12 months, the virus will beat us. But if we beat this virus, which I believe we will, we have it in ourselves. We see examples from all over the world, particularly in East Asia, of communities beating it. Then we're going to have a most amazing sense of self-confidence. We humans have shown that by working together, we can tackle an existential threat. Well, let's do the same for persistent inequity. Let's do the same for the destruction of nature. Let's do the same for climate change. It's like the virus is giving us a test to demonstrate what we're able to do through interdependence, and then to get on top of other things. And I hear countless people who are perhaps a third or a half of my age saying, what are we waiting for? What on earth are we waiting for? Why on earth don't we pool our skills and work together to get ahead of this virus and to make sure that life can go on? And by the way, while we're doing it, let's deal with the inequities that really are making poor people so much poorer as a result of this disease. Thank you for the chance to say these words.